we can now define what the so-called MicroVascular Health Score. And this is a results page as shown by the GlycoCheck system. It shows you that MicroVascular Health Score, which is just taking the capillary density and this flow dependency divided by the level of glycocalyx damage as measured by the flow dependency of that PBR value. And this is just an example showing measurement on myself. So the first score was a 6.3, which is in the mid-normal range. The MicroVascular Health Score generally range between 0 and 10, and normal healthy values are typically between, let's say, a 3 and an 8. And this measurement was done in my morning shortly after big breakfast. And we know, not being fasted and being challenged by a big meal compromises your microvascular health during recovering from that meal challenge. And if you compare this measurement with the measurement a few hours later after recovering from the meal, you can see that that score can typically increase significantly from a 6 to a 9, depending on the condition. So now with the microvascular health score and the GlycoCheck system, you can not only monitor an individual's score, but also see how different conditions and challenges, how they impact your score. Now, if we measure this microvascular health score in the patients group that I earlier described, and this again is going back to the sepsis studies and the COVID-19 studies. And this is the sepsis group. So this was recently published a few weeks ago in the Critical Care Journal on a study that was called the Nostradamus study. So if we measure the microvascular health score in healthy controls, you see they can typically range those scores between 4 and 8. And then the sepsis patients, the scores drop down to 2-ish or less than 1, depending on the level of microvascular damage and organ damage. We see that ones with the biggest level of microvascular damage are also the ones with the biggest number of organs that start failing. So here, the two subgroups have only few organs failing, less than 4, or more than 4 organs failing. So depending on the level of microvascular damage, you see that more organs start failing in these patients in the ICU. Similarly, if we go back to the COVID patients that I referred to earlier, not only are the COVID patients with a mechanical ventilator showing up to 95% loss of the numbers of capillaries, but also we measure on the lower left level of glycocalyx damage. There's a huge increase in glycocalyx damage in the individuals with COVID-19, especially the ones on mechanical ventilation. And again, on the top right, it shows you the microvascular score of these individuals. Again, a normal range would be between 4 and 8. Then the COVID patients drop down to very low values, and the ones that are critically ill, put on mechanical ventilator, their scores get very low, well below a 1 compared to the normal range between 4 and 8 in healthy individuals. And also, if we take this microvascular health score and do follow-ups on the chances of survival of these COVID patients in the ICU, if we take the ones with a relatively healthy glycocalyx and relatively good microvascular scores as a function of the days they spent in the ICU, so they spent up to 2 months in the ICU, you can see all the ones with a healthy microvascular, relatively healthy microvascular system and a good microvascular score, all of them survived their stay in the ICU without significant complications. In contrast, if we look at the subgroup with the most compromised microvascular system and a damaged glycocalyx, you see the longer they stay in the ICU, the more the chances are that they will not survive their stay in the ICU. So with that summarizing, we can now, with the GlycoCheck system, measure live the health of your microvascular system by counting the number of small capillaries, also by measuring how dynamic that number of small capillary increases when blood flow increases, the so-called recruitment capacity, and measure the health of your glycocalyx by measuring how deep the red cells penetrate into glycocalyx and also the flow dependency of that interaction of red cells with glycocalyx. This is it for now. In the next lectures, I will talk about the potential of the endocalyx therapeutic to support the health of your microvascular system and your glycocalyx. And hopefully will be able to help prevent significant damage to the organs of these individuals when their microvascular system is compromised and when they have a lot of glycocalyx damage because of exposure to risk factors or diseases like sepsis and COVID-19. So for now, I thank you for your attention. Looking forward to see you again in the next lecture.